Cholinergic blocking drugs. These are drugs that block or inhibit the actions of acetylcholine in the parasympathetic nervous system. They're also known as anticholinergics. They compete with acetylcholine, and they block it at the muscarinic receptors in the parasympathetic nervous system. These are the receptors that are primarily responsible for the adverse effects of the cholinergic drugs. Natural anticholinergics include atropine, belladonna, hyoscamine, and scopolamine. Within the cardiovascular system, small doses will decrease the heart rate, but larger doses will increase it. So the indications for its use have to do with regulating the heart rate. If we give too much, we get the adverse effect of tachycardia and dysrhythmias. Within the central nervous system, these drugs decrease muscle rigidity and tremors, so they're a natural choice for Parkinson's disease. Again, adversely, they can cause central nervous system excitation and irritability, and large doses of these drugs can cause drowsiness, disorientation, hallucinations, and delirium. Within the eyes, they cause dilation of the pupils, but they can also cause fixed pupils, pupils that don't react to light. They just stay that one size. That's cycloplegia. Why would we use this then? Well, we use them for eye exams. Open up the eye so that we can look inside. The adverse reactions are dilated pupils. You can't react and protect the inner eye from the sun. And that means you also can't focus quite as well. And they're also associated with intraocular pressure. People need to be told that blurred vision is a common effect of these drugs, so they may have trouble driving or operating machinery. Within the GI system, these drugs will relax smooth muscle tone of the GI tract, causing, it also has decreased secretions, both gastric and intestinal. There's relaxation of smooth muscle, and decreased GI motility and peristalsis. So, if it's slowing things down in the GI system, it's natural for irritable bowel syndrome or hypersecretory states within the GI system. These are also used quite commonly preoperatively to decrease all the secretions to make surgery a safer procedure, because you don't want somebody lying there having so much saliva being produced that they gag on it while they're asleep. Adverse effects, well, that's dry mouth. And slowing down gastric motility, that's constipation. Dry mouth can be handled by chewing gum, frequent mouth care, and hard candy. Within the GU system, these drugs affect the muscles and the sphincter, so that they are a good use for incontinence or a neurogenic bladder. It helps people to hold urine in. However, you hold it in too much, that's called urinary retention. That's your adverse effect. Looking at the glandular level, these drugs decrease secretions. They decrease saliva, bronchial secretions, and sweating. Well, that's fabulous during surgery. You don't want, like I said, you don't want people having lots of secretions while they're asleep during surgery. But it can cause decreased sweating, and sweating is something that's a positive thing. It helps people to maintain their own temperature status. So it can lead to heat stroke, especially in the elderly. So we need to be telling people, you're taking these drugs, you need to limit your physical exertion and avoid high temperatures and strenuous exercise. And make sure you get an adequate intake of fluid and salt. Within the respiratory system, decrease secretions, but also relaxed smooth muscles in the bronchi and bronchioles, and decreased airway resistance, bronchodilation. So what do we use it for? Asthma, chronic obstructive pulmonary disease, chronic bronchitis, and exercise-induced bronchospasms. The adverse effect, decreased bronchial secretions. Bronchial secretions are there for a reason. They help move the fluid around and also move some of the dust and dirt that we all breathe in out of the lungs and the respiratory system. Well, if you don't have secretions, you can't do that real well. Overall nursing implications. Medication should be taken exactly as prescribed, and overdosing can have life-threatening problems. Check with physicians before taking any other medication, including over-the-counter, and know that the antidote to atropine is physostigmine. Patients should report any of these adverse effects: urinary hesitancy and/or retention, constipation, palpitations, tremor, confusion, sedation or amnesia, excessive dry mouth, especially if they have chronic lung infections or disease. Their mouth is dry. You can be pretty sure they're not making the bronchial secretions to clean all that stuff out. And they also need to call if they have a fever. Most of these are due to getting too much of the drug in their system, and their dose needs to be readjusted. We're going to monitor for therapeutic effects. People with Parkinson's should have fewer tremors and decreased problems with drooling. If they're taking it for urinary problems, they should have improved urinary status. They should have less hypermotility and increased time between voidings. These are those drugs that you see on television for people who have to go all the time. The women especially that have to go all the time. And we're monitoring for adverse effects.